Hi everybody, my name is Mitchell Farmer and this is Laboratory Aid of MSK covering the anterior and posterior compartments of the arm. So I'm going to start us off with some osteology of the distal humerus, take us into that multicolor mode. We're looking at an anterior view of the humerus. I'm going to zoom in a bit here. So I'm going to start us off with the coracoid fossa. So the coracoid fossa is a fossa on the anterior aspect of the humerus, which receives the coracoid process of the ulna during flexion of the forearm. Inferior to that, and the most distal portion of the humerus, is the trochlea. The trochlea is the medial portion of the articulating surface of the humerus, and it will articulate with the trochlear notch of the ulna, which I will show you shortly. Of course, there's the medial and lateral epicondyles, and then there's something known as the capitulum, which articulates with the radial head. If I rotate, so we're looking at a posterior view of the humerus, the thing that stands out most is a depression at the back of the trochlea, known as the olecranon fossa. It's there to accommodate the olecranon of the ulna during forearm extension. Okay? Those are kind of the most important things that we want to go over for the humerus. So I'm going to X out of that, and I'm just going to, before going in to look at the ulna and some of its, kind of look at its multicolor mode, I'm going to try and show you what I just covered. So basically, you have, this is the capitulum, you kind of rounded ball here, articulating with the radial head. So here's the radius. If we rotate around this way, we have the olecranon fossa, articulating with the olecranon process of the ulna. And then we have the trochlea articulating with the trochlear notch here. Okay? So now if I take us in that multicolor mode, I can kind of show you. This is the trochlear notch, which will articulate with the trochlea of the humerus. Here's the olecranon process, which will enter that olecranon fossa. And then there is the coracoid process, which articulates with the coracoid fossa during forearm flexion. All right. And then there's the ulnar tuberosity, which is important because it's the attachment point of the brachialis muscle. And then if we go all the way to the bottom, we can see the distal coracoid process of the ulna as well. I'll X out of that and quickly go over the radius. So the radius is pretty simple. We have the head, which articulates with the capitulum of the humerus, then the neck, and then there is the radial tuberosity highlighted here, which is the attachment point of biceps brachii muscle. It's the common attachment point of both the long head and the short head of the biceps brachii muscle. I'll X out of that. Now, there are several joints that are formed by all of these different attachments. We have the elbow joint, so to speak, which is actually a combination of three joints. There's the capitulum and the radial head, one joint. There is the trochlea and the trochlear notch right here. And then there's the proximal radial ulnar joint. So there's actually a joint between the radius and the ulna itself, which is also part of the elbow joint. Other joints include the distal radial ulnar joint below the extensor retinaculum and all of this ligaments here. And then the middle radial ulnar joint, which is basically just the interosseous membrane extending between the ulna and the radius. Now, I think the best way to show you exactly how everything works for this kind of complex elbow joint is to show you when the elbow is flexing how everything moves. So I'm going to go to biceps brachii, and I'm going to go to elbow or to flexion. So this is biceps brachii, and it's causing flexion of the arm. So if I zoom into the elbow joint, you can see how, for example, the capitulum moves along the radial head, and if I rotate posteriorly, you can see how as the arm extends, so this is flexion, and as the arm extends, the olecranon will enter the olecranon fossa, and the trochlear notch will receive the trochlea of the humerus. So hopefully that gives you a better idea of exactly how all this works. And I'll exit out of here. Alright, so that's enough for osteology for now. I'm going to go on to discussing the anterior arm. Alright, there we go. So, the anterior arm. I'm going to start on the model's right, or your left, over here. Starting with the long head of the biceps brachii. So I'm going to hide the cephalic vein. So the long head of the biceps brachii, its proximal insertion is the supraglenoid tubercle of the scapula. So this is the scapula, recall. But it's also continuous with the labrum of the glenoid fossa. So the labrum of the glenoid fossa doesn't exist in this model. I'm going to hide this. But essentially you have the glenoid fossa here, which articulates with the head of the humerus here. Humerus, scapula. And this is continuous with the labrum that kind of provides a lip to the glenoid fossa so that the humerus better sits in it. So if you tear the long head of the biceps tendon, you can also cause a tear in that glenoid labrum as well. And so as we travel distally along the tendon, recall that the tendon of the long head of the biceps tendon travels through the intertubercular groove between the greater and lesser tuberosity of the humerus, and that groove is briefly turned into a canal by the transverse humeral ligament going atop it. And then if we can continue following it distally, it has a common tendon with the short head of the biceps brachii, and that is the radial tuberosity, which I showed you earlier. So since the biceps long head crosses two joints, crosses the shoulder joint, and then crosses the elbow joint via this tendon, it's unsurprising that it causes movement in both of those planes. For the shoulder, it helps in accessory flexion of the humerus at the shoulder joint, whereas for the arm and forearm, it's primarily, the most important thing it does is actually supination about the elbow joint, but it also aids in flexion of the elbow. And so if I click this, and I can actually show you supination here. So this is the action of supination of the elbow. So you can see how as this tendon pulls on the radius, it would pull it around the ulna and cause that supinating motion. So this is supination, this motion right here. Okay? So it's most important for supination, but it also allows for flexion. It's supplied by the brachial artery, and it's innervated by the musculocutaneous nerve, which can actually be seen here kind of tracing along it, originating from the spinal roots of C5 to C7. Then there is the biceps brachii short head, which has the same distal insertion, but its proximal insertion is the coracoid process of the scapula instead of the supraglenoid tubercle. And that coracoid process, it has a common tendon with the Coracobrachialis seen inferior to it here. So often these tendons are fused together actually. So I actually will discuss the Coracobrachialis next on the model's right. Zooming out here, so this is an anterior view. So the Coracobrachialis is deep to the short head of the biceps, and like the short head, its proximal attachment is the coracoid process, as discussed. It inserts into the midshaft or middle third of the humerus. So it asserts along the humerus in its medial aspect in the midshaft. And its action is that it sits with flexion and abduction of the arm about the shoulder because it crosses the shoulder joint, so it causes action in the plane of the shoulder. It's supplied also by the brachial artery, and it's also innervated by the musculocutaneous nerve. In fact, it's worthwhile saying that all of the muscles of the anterior compartment, the biceps brachii, long head, short head, coracobrachialis, and the brachialis muscle, are all innervated by the musculocutaneous nerve. Okay? So the final muscle I want to discuss is the brachialis. So the brachialis can be found deep to the biceps brachii and superficial to the humerus on its anterior surface. Its proximal attachment is the anterior surface of the distal half of the humerus, so here. And its distal attachment is the ulnar tuberosity. So recall the ulnar tuberosity, which I showed you earlier. That's where the brachialis attaches. It's supplied by the brachial artery, and its action is it causes flexion of the elbow. And it's the main, importantly, it's the main flexion of the elbow when the forearm is pronated. Because you know the biceps, they supinate the arm. And so their lever for flexing the forearm is reduced when the arm is pronated. And so that's primarily the brachialis muscle highlighted here, which will cause flexion of the arm when your arm is pronated about the elbow joint. Okay. So I'm going to pull up the posterior compartment now, which is a bit simpler. All right. So the model's already rotated, so we're looking at a posterior view of the arm here. The biggest thing, or I guess the most important muscle in the, and the only muscle in the posterior compartment, is the triceps brachii. So triceps brachii is composed of 3 heads, the long, lateral, and medial head. So here we have the long head, the lateral head, and if I hide this, it's actually difficult, but kind of deep to and medial to the long head is the medial head of the triceps brachii. So those are the 3 heads. Their proximal insertion, so they have different insertions. The proximal insertion of the long head is the infraglenoid tubercle of the scapula. And then you can see it, if you're having trouble finding it, look for a tendon passing between teres minor superiorly and teres major posteriorly, or sorry, inferiorly. It passes deep to teres minor and superficial to teres major, as can be seen here. Whereas the proximal insertion of the lateral and medial head, they have a common proximal insertion, is the posterior surface of the humerus shaft, superior to the radial groove. Now, they all have a common insertion via the triceps brachii tendon, or the triceps tendon, and they all insert onto that olecranon process of the ulna that I showed you earlier in the lab. Their action is to extend the forearm above the elbow joint. So I'll actually show you that action right now, if it lets me, but I don't think it's going to. So sorry about that. For some reason, it's not letting me show you extension of the elbow, but basically it's the opposite of flexion of the elbow. You're gonna have to look that one up, I suppose. So its artery that supplies it is the deep profunda brachial artery. So recall that I showed you the branches of the axillary and brachial artery last lab. So that deep profunda artery I showed you is what supplies the triceps long and short head. Or sorry, the 3 heads of the triceps. And the nerve that innervates them is the radial nerve. So if you remember from when I covered the brachial plexus, the radial nerve is one of the branches of the posterior trunk. So that is what supplies the posterior compartment, and thus the triceps brachii muscle. The one last thing I want to discuss is the ulnar nerve, which I've highlighted here, just as I'm looking at this posterior view. And the reason I want to discuss it is that it travels along the posterior and inferior aspects of the medial epicondyle of the humerus. So here's the humerus. This is the medial epicondyle, and it travels along the posterior aspect of it. And the reason that's important is because here it's vulnerable to injury. So basically when you hit your funny bone, so to speak, that's hitting the ulnar nerve in this area of your body between the olecranon process and that medial condyle. And it can also have pinching there as well. So that's just important to consider as we're looking at this posterior view. So that's everything for part 1 of Lab 8. I will see you for part 2 shortly.